everyone, my name is Nia Woolery and this is my second case study. It is in regards to preeclampsia. Okay, so the subject of this case study is Susan. She's 19 years old. She's kind of a picky eater. She likes to eat meat and potatoes. She almost never incorporates fruit and vegetables, with the exception of corn, peas, bananas, and oranges. She loves sugary beverages such as chocolate milk and sweet tea, and she drinks them every day. She noticed she started to have some health problems and complications at 8 weeks of pregnancy. She has preeclampsia, high blood pressure, proteinuria, and the diabetogenic effect of pregnancy, which just means that her blood glucose levels have increased and she is insulin resistant. She was a bit overweight prior to the pregnancy, so she tried not to gain any weight during the course of the pregnancy, and she was very restrictive with her salt intake following 22 weeks. Her baby was born at 5 pounds 5 ounces via cesarean section at week 36. So the first question was list 3 ways in which Susan's dietary intake likely contributes to oxidative stress. So firstly, oxidative stress is an imbalance between free radicals and antioxidants in the body. The presence of oxidative stress and a lack of antioxidants plays key roles in the development of preeclampsia. So because Susan's diet is very limited, it has contributed to the formation of oxidative stress in the following ways. Firstly, Susan's diet lacks vitamin D. And like I said before, she does eat a diet mostly of meat and potatoes with occasional vegetables such as corn or peas, and she'll sometimes eat bananas, oranges, and drink her chocolate milk and sweet tea. But these foods don't contain much vitamin D. I did mention she drinks chocolate milk. If the milk is fortified with vitamin D, that's excellent, but it's not enough for her daily intake. So I would recommend that she would need to incorporate fatty fishes like salmon, tuna, mackerel, and some plant foods such as mushrooms in order to get more vitamin D in her body. Secondly, Susan's diet is also deficient in vitamin E. Vitamin E is a fat-soluble antioxidant. So she definitely needs to incorporate more plant foods, nuts, and oils into her diet. Like I said before, oxidative stress and lack of antioxidants can contribute to preeclampsia, so that would be a first step for sure in getting rid of that preeclampsia. And then lastly, Susan frequently consumes high sugar beverages in the form of chocolate milk and sweet tea. These sugary drinks are known to increase chronic inflammation and oxidative stress, so she definitely needs to cut some of that out, incorporate some more water into her daily diet. Question number 2, identify 2 other characteristics of her diet that are contraindicated for women with preeclampsia. Okay, Susan loves to eat meat. The text does not specify what kind of meat she eats, but being a 19-year-old picky eater, I'm going to make an educated guess that some of the meat Susan eats is processed. So diets that regularly include processed meat are contraindicated for women with preeclampsia. Another contraindication is Susan's strict restriction of salt intake and weight gain during pregnancy. And I mentioned before that Susan was a little bit overweight before becoming pregnant, but it's still recommended that she gain between 11 and 25 pounds over the course of her pregnancy, according to the pregnancy weight gain recommendations in the text. It is not suggested that pregnant women routinely restrict salt in their diets. Clinical studies have proven that salt restriction during pregnancy does not prevent preeclampsia, hypertension, or other pregnancy complications. And last but not least, question number 3, list 3 health problems Susan is at increased risk of developing due to her history of preeclampsia. So due to Susan's history with preeclampsia, she is at increased risk for developing acute renal dysfunction, which is kidney problems, hypertension, and type 2 diabetes later in life. All right, and these are my references. Thank you so much for your attention. I hope you enjoyed it.